The last presentation from Amanda Cordell that I made yesterday. She's the Chief Executive Officer of the Eosinophilic, let's say, gastrointestinal disorders, I would say. Is when we started esophagitis, but then we learn a lot. And let's say this is a rare chronic immune condition that can severely impact quality of life. The network that she has created provides patient support that raises awareness among clinicians and advocates for research and improved diagnosis. Amanda, the floor is yours.
Thank you so much for the invitation to speak, and you've kindly already introduced me. Okay, so let's start with our journey. It started a long time ago, which makes me feel very old, back in 2003, when my son was born with complex gastro and skin disorders, which was diagnosed as eosinophilic gastrointestinal disease at 7 months. By 2004, because there was such limited information available back then, I mean, in a one-page journal document I was given, we traveled to Cincinnati where research was happening to meet researchers there because there was nothing else available. And it became very apparent that there was an acute need for patient support. And I went back to the UK and started a Yahoo online support group, if anybody remembers what they were. By 2007, we went on to have our daughter, who sadly was also diagnosed by the time of 6 months with eosinophilic gastrointestinal disease. Is it genetic? Maybe. By 2010, we'd registered the organisation as a charity, and we were supporting around about 250 families then because we still thought that this was a childhood disease. And fast forward to 2018, we then went back and relaunched the organisation as a global charity supporting people from cradle to grave, because by then we knew this was definitely a chronic disease. And we were then working, as I'm going to tell you, not only with patients but with healthcare professionals too. Next slide. Next slide. Okay, so our mission is to ensure that every person with an eosinophilic-associated disease receives a prompt, accurate diagnosis, cohesive medical care and support to live with their condition. Very big mission. Next slide. Our reach is a registered charity with a global multidisciplinary medical advisory board and trustees. We have a network now of actually over 700 HCPs since being here, and across 58 countries we have 1,500 registered community members. I'll go on and explain what they are. And we actually reach now 5,000 new visitors a month on our website, covering over 160 countries. We are the patient voice in many places. We represent the patient voice here now kindly at the UEG, ESPGHAN, EACI, BISPGHAN, ARN and more. And we're working with multiple stakeholders, medical institutes, research centres and policymakers and industry to change the future. And we provide patient participation and involvement in research. We have co-authored 20 papers, including EOE and EGED research and guidelines and EAD care improvement position papers. Empowerment. This is absolutely key as a patient organisation because the patient is the thread that runs through this complex journey. We provide regular patient support meetings. We provide downloadable tools and resources for you and your patients. And we provide educational events, not just on eosinophilic gastrointestinal disease, but the comorbid conditions, thinking about a holistic approach. We also run a campaign throughout the whole of May. This encompasses all of the world's days and weeks because this is a big, complicated disease. And in 2025, we actually had over 29 partners. It was our biggest year yet, very exciting. We provide a whole toolkit. If you want to get involved, it's very, very easy. It's not difficult for you to do this. Next slide. And as you can see here, 37 partners, see I underestimated what we did, joined us in 2026, and you can see here some of the involvement that they've had. Even if it's just down to sharing a post, you are reaching more people. It's very, very important. So how do we do it? It all sounds amazing. Okay, so EOS Network in the middle, two halves. We have a community hub that's there to support patients and their families and carers. And on the other side, we've got our healthcare professional network. We worked with rare diseases in the original space because EOE was originally rare, no longer. And that was to increase disease awareness, to connect and collaborate, to change that space. Obviously, we work with other patient support groups, national and local patient organisations. If there's somewhere more local to send your patient, we will send them there to support them alongside us. And of course, our patient voice is the centre of everything that we do to develop our resources, and actually key to everything because they're the ones that know. And then alongside that, our global healthcare professional network means we can collaborate in global research. And then we provide the platform because this is absolutely key. It doesn't matter how wonderful your research is that you do. If nobody hears about it, it's no good. So we help disseminate that information. And then alongside it, as we've already said, we work with multiple associations, providing that patient participation to ensure that everything is patient-centered through from research, education, disease awareness, and of course access to meds, which leads me on to the last piece of this slide, which is trial development and industry participation, obviously. And then most importantly, it's great doing the research and developing these treatments, but if patients don't get access to them, they're no good at all. So this is a really complex slide, and I'm not expecting you to understand all of it, but it demonstrates how complicated a patient organisation is and how many touch points we have and how many people we join together. Okay, so some insights from our organisation. This is some data from 2021. Very sadly, you can see here that the adult community for EOE were averaging 8 years to diagnosis. This hasn't changed much, I have to tell you, and over a third of them were over 10 years. These were the sayings that we were talking about in 2021, all patients commenting about the difficulty swallowing. But actually, it's far more complicated than that. Next slide. What we learned from our community after discussing with them that there are multiple points of entry and exit into the healthcare system. Primary care, pediatrics and of course transition, gastroenterology and nutrition, pathology, emergency care and food bolus obstructions, ENT, pulmonology, and obviously the allergy department. So it's a complex journey. How can we change this? We developed a resource. We collaborated with other patient organisations to develop this tool, and it's been very, very well received. This is looking at the wider signs and symptoms that are silent and often slow and insidious. People don't realise they have this disease. We've also developed a position paper which we'll be rolling out over the next year to advocate for better access to care and for access to treatments. And finally, let's talk about how all of this work has made a difference. So I'd like to tell you a story about a young man called Fergus. He was born in 2003. It's not my son, by the way. So in his early years, he was exposed to postnatal antibiotics. He had a family history of allergy and related conditions. His mum was an experienced nurse, surprisingly a specialist in endoscopy. He had allergy concerns that were first identified at weaning stage. He had eczema. He was diagnosed with multiple life-threatening allergies, and he was on a highly restricted diet, only tolerating baby rice, pear and cooked apple. And by the age of 4, he developed asthma and chronic rhinitis, reflux and regurgitation. So for those gastroenterologists in the room, and I think there's a few of you here, you will know, if you know about EOE, this is not an uncommon story. So growing up, Fergus, by the age of 8, had started finding it difficult to swallow sandwiches. By the age of 10, he had headaches and abdo pain, frequently sick, and has to drink lots of water when eating his meal. By the age of 14, he thought he was choking, an ambulance was called, and then he regurgitated a lump of meat. By 15, he had a big gastro flare, which actually caused bleeding in the lower bowel. And by 17, he had a food obstruction and ended up in A&E. And biopsies were taken, hallelujah. So by 17, in December 2020, he gets a diagnosis. He's got EOE, he's got a duodenal ulcer as well. His family, no surprise, mum's a nurse, gets on the internet and Googles eosinophilic esophagitis, and she reaches out to us for one-to-one support. But the battle goes on because his symptoms don't subside. Despite this, he has multiple hospitalizations, the treatments that he tries, PPIs, steroids, further diet restrictions, because remember, he's already IgE allergic. He's tried pain relief. Everything was actually either short effective or not effective at all. By 2021, no surprise, the whole family is impacted by this disease. Fergus can't trust anything he eats. He doesn't want to eat outside. He's terrified. He's always drinking lots of water, and he's very fearful that whatever he eats is going to get completely stuck. He's in a constant mental battle. He's finding that it's difficult even to get up in the morning because he's in so much pain. Again, his family reaches out to us for a touch point and says, how can we help? And he joins our community chats and meets other community members who are struggling, which was very empowering for him. And at this point, he says to his consultant, have you heard of EOS Network? I think you should join. He's not quiet, this boy. So Fergus introduces his doctor to some of the tools that we've developed. And he says, in particular, the food bolus action plan that we developed with our community and healthcare professionals was incredibly helpful. Because when he did turn up to A&E, it empowered him to be able to explain his condition. So, EOS beyond the esophagus. By 2022, he's on dietary restrictions of 6 fed and more. He's on PPIs, he's on oral topical steroids, and he's re-scoped, and it's less than 15 per high power field, but he's still not well. At 18, he's back in hospital, in and out due to pain and gastro symptoms. He's re-scoped and more biopsies are taken upper and lower. And Fergus is really struggling by this point. He's a young man, he's at university, he can't attend, he's desperate to get through his degree and he's working from his bed. And so surprisingly, his cousin then gets diagnosed with EOE too. So we're back to genetics again, aren't we? So he's become a strong advocate by this point for EOS Network, and he's joined some of our webinars, which has educated him to be able to ask the right questions and to talk to others about his disease. And so how can we help improve his condition? So in 2023, EOS Network uses our network, and we connect his healthcare professional to an expert elsewhere, and they discuss his case. By 20, the additional scoping reveals after the discussion that he's got EOD and EGE. He's put on a short course of systemic steroids to provide short-term relief, but it's not a long-term solution, as we know. And an application is made for Dupixent for a 12-month trial. The 12-month trial takes place. He's very excited. It's added to his existing treatments initially, and he gets a huge improvement. Now, no surprise, he doesn't get improvement just in his gut. He gets improvement in his skin, in his breathing, in his nasal. But after 6 months, they suggest let's try and remove some of these other treatments. We shouldn't need all these other treatments, but sadly, that wasn't as effective. And of course, we've now come to the end of the 12 months. What's going to happen? So his healthcare professional then had to advocate for additional long-term care. And during that period, that short 2-month period, the symptoms rapidly returned. But we have a nice ending to the story. We all love a happy ending. We hope so. So at 22, the long-term treatment was approved. Hooray! And he was put back on the combination treatment. And I'm very pleased to tell you that Fergus has completed his degree, he's got a job, and he's moved out, which is wonderful news. And his family have become firm advocates in what we do. So how can patients get involved? They're involved in PPI, and they're involved in raising funds and supporting us and supporting others. Next slide. And they're very dedicated. I know he would be here to tell you if he could himself. So our vision is a world where lives are no longer inhibited and controlled by Eosinophilic-Associated Diseases, and we invite you to help us achieve this. We have a global healthcare professional network, as I've said. It gives you an opportunity to share your research, connect with other healthcare professionals, gain valuable patient insights, stay up to date with international research, access practical tools as I've shown you, and to refer your patients to a trusted platform. And here's one researcher who kindly came up to me this year at a conference and said she'd managed to share her research through our network and has connected with lots of other healthcare professionals. So thank you for the opportunity. Please scan the QR code or come and see us at our booth, and I'm happy to answer any questions.
Thank you, Amanda. It was really amazing. Do we have any questions to Amanda? You impressed everyone, I guess. But I think you can stay here. Maybe you can have a chat in between. I think, thank you, Amanda, then.
Thank you.